Yes. Yes, I feel like we've seen each other almost every day now.
Good
All
luck and
right.
enjoy your time. We've got a good crowd.
Thank you. Yes, it looks amazing. So many people. So just let me know, Haley. Should I just share my screen when I'm ready?
Yeah. If you want to give it one more minute and then we can start and you just share your screen and kind of go self-paced. If there's any questions in the chat, I'll interject. Otherwise, we can hold stuff until the end.
Okay, sounds great. Yeah.
But as an introduction for everyone, before she starts, Isabel's currently working on her doctoral, her PhD, in clinical psychology at Illinois Institute of Technology. She specifically focuses on disordered eating in athletes, and today she's specifically building on what Dr. Hamster-Wright was discussing earlier about REDS, specifically in males. And you can take it away whenever you're ready, Isabel.
Great. Thank you, Haley, for that introduction. So yes, as Haley mentioned, my research and clinical focus is on body image and disordered eating in minority groups. It was initially in ethnic minority groups and has now transitioned into looking at athletes, specifically male athletes who are very underrepresented in the field of body image and disordered eating in particular. And so today what I hope to discuss with you all is the risks of body image, specifically body dissatisfaction experienced by athletes, which can lead to an increased risk for disordered eating, as well as an increased risk for REDS. And it sounds like there was already a presentation on that, so this will not be completely a new topic introduced. And then to go over a little bit about where the field seems to be headed and the future work that is still necessary. So briefly to go over, so body image is defined as an individual's internal representation of their outward appearance. And this includes evaluative thoughts, beliefs, feelings, and behaviors related to one's own physical appearance. There are many theories about body image. One of the main ones is the socio-cultural theory of body image, and it says that there are society and cultural messages that are conveyed to individuals primarily via media that assert the male and female ideal bodies. And these described ideals and messages put a lot of pressure on these individuals to attain that ideal body image. And so for females, the typical ideal is considered to be a thin ideal, so very small and thin in many areas of their body, versus the male is thought to be lean, but also muscular in the right areas. And so historically, literature and research on body image has been mostly focused on women, and again, their desire to become thinner and achieve this thin body ideal. But in recent years, more research has been conducted with males and noticing again that there are differences in their body image and that males do in fact endorse an ideal body image and body image concerns. Which brings me to my next point of body dissatisfaction. And so body dissatisfaction occurs when there is a discrepancy between how an individual views their own body compared to the body type that they perceive as ideal. Again, the ones that were demonstrated from those messages. And typically, body dissatisfaction is considered with body shape and weight, but actually more research is looking into different features, which is out of the scope of this presentation, but it's important to know that there are different features that individuals can be dissatisfied when considering their body dissatisfaction. And so body dissatisfaction may lead to the development of eating pathology and other concerns such as anxiety, depression, and low self-esteem. And much research has demonstrated these associations. So one interesting thing that I have been focusing more and my team has been focusing more on is this idea of contextual body image. And it's specific to athletes because the contextual body image says that there are different body images or ideals that people may strive for depending on context. So the athletic body ideal is defined as the internal image one has of his or her body and the evaluation of that image within an athletic context. So I thought these pictures demonstrate all of the differences that all the different body images that could occur in a sports context. We see, especially these three very well-known athletes, all have very different bodies, but are considered some of the best in their sport. And especially for males, again, Michael Phelps, who's a little bit more lean, less muscular than would be maybe some people would say they're ideal. So experts in this area suggest that, athletes may strive for a specific body ideal for around 3 reasons. One is a desire to attain a precise body appearance for his or her specific sport, like I mentioned. One is for performance enhancement benefits, which we'll talk about more when we talk about REDS. And then 3 is, again, that socio-cultural pressure for these individuals to reach their ideal body shape. So again, their athletes experience pressures not only in their daily life, but also in their sport context, which may put them at a higher risk for those consequences of body dissatisfaction that we mentioned. Okay, so very briefly, just, what do I mean by like the context? So to consider whether an individual is an athlete or not, to consider the sport type. So on the left, we see what is considered a weight-sensitive sport. This previously was considered lean promoting, where leanness and lower body weight contribute to greater performance, versus a non-weight sensitive sport or non-lean promoting, such as the picture on the right, where leanness is less important for performance. And even the position that a player may play. For instance, in football, when there are so many different positions, it's important to note that they may have different body types depending on what position they play. And it's important to take in all of these contexts when we're assessing their degree of possible body dissatisfaction and behaviors that they may engage in to attain that certain ideal. So, this main point is that if we do not assess body images or body image concerns in both a daily life and sport context, we may be missing some of this dissatisfaction.
So we have a quick question in the chat. Nanad was wondering if bodybuilders have, if you would say bodybuilders have body image issues as well.
Yes, so that is a great question. And actually, very interestingly, bodybuilders were one of the first, I would say, like athletic groups that have been considered for research and have been looked into because of their body image. It's so different than what would be considered like the average male. I'm saying this just typically the bodybuilder research has been with males, even though I know there are female bodybuilders as well. And so, yes, and so, talking about what their differences in body dissatisfaction, whether they're in their daily life, again, or versus they're in the bodybuilder sort of world, has been explored. And as I will talk about a little bit, the behaviors that they have to engage in to reach those body types can sometimes can lead to like a disordered eating or disordered behaviors, and that can put them at a higher risk. And so a lot of the research with bodybuilders has been to like assess their degree of risk of this population. And, is this a population where we should be providing more education and assessing more frequently or paying more close attention given the risk that they are in? Did that answer your question?
I believe so. If it pops back up, I will let you know.
Okay, perfect. And I will say another one that has been highly researched is jockeys for those that ride the horseback, given their smaller size that's needed, and those athletes that are in wrestling due to the weight class differences. And so what kind of behaviors do they need to engage in to get to a higher weight class or a lower weight class? A lot of the research with disordered eating behaviors has been with those athlete groups as well. So definitely differences based on groups. Okay. So I wanted to make a quick note. A lot of the language that I'm using, I've been using more of the disordered eating behaviors when I'm describing. And that's because, again, we don't want to use a clinical eating disorder unless we know for a fact that they meet criteria. And so what does this mean? It's if they meet criteria of certain behaviors of frequency and duration, if they meet a certain threshold to meet a clinical diagnosis. But disordered eating behaviors can be just as problematic, if not more, since they may be undetected. And disordered eating behaviors may lead to the development of an eating disorder eventually. So it's still important to identify and try to engage in early intervention as soon as possible. And again, why we focus on why this topic is more on athletes is that research has shown that some research has shown higher rates of disordered eating behaviors in athletes compared to non-athletes. So while previously it was thought that athletes would be protected from these types of behaviors due to wanting to be healthy for their performance, research has actually found that more athletes are at higher risk and demonstrate more of these disordered eating behaviors, but they may go undetected. So that's important to bring up. I wanted to emphasize that point. So when thinking about these eating disorder risks, as I mentioned, body dissatisfaction is one of the well-known ones. And we talked about sports type and contextual body image have been shown to be risk factors for disordered eating, but research has also found that a desire for enhanced performance, comments from coaches and social pressures, and desire to fit into a specific uniform, these are all unique to athletes, and they may increase their risk for disordered eating behavior. So again, we need to take into consideration kind of what environment are these individuals placed in, and may they increase their risk. So now getting to this idea of low energy availability and its connection to REDS. So low energy availability occurs when an individual's dietary intake is insufficient to support their energy expenditure, the energy that's required for their health, their function, and their daily living. So this takes into consideration both the cost of exercise and sporting activities, as well as like their daily living. And so low energy availability occurs when there's a mismatch between an athlete's energy intake or their diet and the energy that they expend in exercise, which may leave them with inadequate energy to support their functions. And so when an athlete has low energy availability, they're not getting enough nutrients to fuel their body. And so for one of the most obvious reasons of how this can occur is when an athlete is not eating enough calories, or if an athlete is engaging, again, in that disordered eating behavior, such as excessive exercise or restriction. But this can also happen if an athlete is eating enough calories, but the athlete is not eating enough nutrient-dense foods. And research has found that, many athletes will eat, a large amount of food, but they may be empty calories and not getting that significant nutritional value that they need. And then athletes might also be eating what is considered a normal diet for a non-athlete, but could be unknowingly consuming too few calories and or nutrients for how active they are. And so here we see the importance of ensuring that athletes have adequate sports nutrition. And actually more and more research has been shown that athletes actually lack this form of nutritional knowledge, or what's being called sports nutritional knowledge, which may explain their increased risk for low energy availability and the consequences that may follow. And so just to clarify that some people think that, anyone with low energy availability has an eating disorder, but that's not necessarily true. So some athletes with low energy availability or REDS, which we'll discuss in a minute, do have full-blown eating disorders, but others may just eat healthy foods and just not realize, again, that they're eating too little given their energy expenditure as an athlete. And still others may eat enough calories, but not enough dietary fat or other key nutrient. So again, this is why we note how disordered eating behaviors can be problematic, even if it does not reach a threshold of a clinical eating disorder. These disordered eating behaviors can still have these consequences. And so sounds like it's been discussed, but so relative energy deficiency. So first, what was first considered in the field was the female athlete triad, which is seen in this top picture. And that was only considered for female athletes because it required, menstrual dysfunction, and it looked at bone health. And so of course, with males, we're not going to see that menstrual dysfunction. So when low energy availability was recognized and detected in male athletes, researchers and clinicians expanded this idea to get to REDS. And so while low energy availability underpins kind of REDS. And so here we see the effects of REDS, so the physiological in the top picture. So there's so many consequences that can occur. But then on the bottom picture, I like this one because it also indicates the different sports performance consequences that can occur. So a decrease in sports performance, which for many athletes is very important to them. And so it's been, thought to kind of present to athletes more, these consequences in hopes of further educating them of the need to, address these consequences or address these risk factors sooner rather than later. And I will say it's important to note that there is still stigma surrounding mental health in general. And there's also stigma surrounding eating disorders or disordered eating behaviors in males. So that's kind of why our team wanted to continue researching and providing care for male athletes who may think that, disordered eating or eating disorders are only experiences by females. But we know that that is not the case. And so by providing further education to the athletes and to those around them, we hope to continue to break that stigma and provide sufficient care for the athletes. And so, who can refer or provide this support? A lot of research has gone into educating those that are around the athletes, such as coaches, athletic trainers, sports dietitians, the team physicians. And really the idea is that anyone who is close enough to the athlete has a close enough relationship that they can discuss these topics that are typically not discussed among the athletes themselves. And so for the future work and the main takeaways, research has begun to show that peer-based eating disorder and body image programs have shown promise in decreasing body dissatisfaction and the resulting eating pathology, such that now providers are calling for similar REDS peer-led programs that are interactive and target athletes and coaching staff. And so again, this aligns with what we discussed about who can refer and who should therefore have this knowledge. In addition, early detection of athletes at risk for energy deficiency is critical to prevent those long-term health consequences. And further education may help alleviate some of the stigma associated with eating disorders that may motivate athletes, especially male athletes, to hide their illness. Especially in a sports context, it can be easier to hide their disordered eating behaviors as, reasons, well, I need to exercise this amount for my sport, when it could be more disordered. And so yeah, that was what I had for everybody. So now I'm interested to hear any questions or any discussions.
Awesome. I have one question for you currently, and then if anyone has questions, please just send them to the chat. My question for you, Isabel, would be just if you could reiterate the importance of using and studying this research to include male athletes, the similarities and differences between male versus female in the presentation of behaviors and similarities, differences. Why is it important to include male athletes in this research?
Yeah, great question. Thank you, Haley. So I think one of the first things to note is, the measures that we use and the way that we assess these constructs, such as like body image or eating pathology, have really been validated and really heavily studied with females. And so for now, a lot of the research is, modifying those instruments and asking male athletes very similar questions, but we're not exactly, sure if we're truly assessing what we think we are, because this is a new population, just like you would want to validate any measure with a new group that it was not originally created for. And so what does this require? It requires, more validation studies, using measures, communicating with the target population, in this case would be male athletes, to kind of hear from them firsthand what their experiences are, to better understand. And then you want to better understand from that population, create questionnaires and assessment tools based on those findings, and then disseminate to those groups to really test out if what we're measuring is in fact, what the construct is. And then again, based on those findings, similar to with female athletes, to create the intervention and prevention, workshops or again, those programs that are needed for these athletes.
Perfect. And one more question. How can sports medicine professionals start a conversation with athletes about REDS?
Yeah. So I think as I mentioned, those two photos, I think sometimes, as athletes, the top photo of like all the physiological consequences can seem like, oh, that will not happen to me as an athlete. But then when you see those impairments for performance, that would be, more impairing for them in the moment if they were, in season. So having that discussion about athletes where, their goal is to perform well in their sport. And so bringing up how REDS can impact their performance may be a way to engage with athletes, kind of get that first buy-in is what we talk about a lot of, how to make them pay attention at first and then transition into, the larger picture of all the consequences. But I think for sports medicine, it's really about, how do we get the buy-in and engagement with athletes by targeting topics that are important to them as well.
Perfect. Awesome. I don't think we have any other questions in the chat. If they send anything in the chat, or if anyone sends anything in the chat. Oh, wait, actually, we have a question right now. Are eating disorders more common in elite athletes or, I guess, as opposed to club athletes?
That's a great question. And so they're actually starting to look at that more, trying to differentiate, between those two. I will say that the research is still fairly new, looking at athletes, and a lot of their research has been with collegiate athletes because they're just a sample that's very easy to to gain access to, whereas the elites have been, I've seen more like case studies with elite athletes. So I would say that the literature is mixed because some have found like they have more pressures and so they are at a higher risk, but they may have more resources serving as protective factors, such as like more individual, dietitians and team physicians that are at their disposal for the elite athletes, protecting them from these risks. So I would say the literature has shown it both ways, but we need more larger studies to kind of confirm these studies.
Sure. Yeah, sure, more comprehensive. And then Dr. Carey talked about a experience that confuses athletes, like an unseen experience. How might this research help them tease apart the physical from emotional response?
The unseen experience, could you just clarify that, Haley? What did you mean by that?
JCL actually brought it up to me, but I'm unsure.
Yeah, thank you, Isabel. So this morning, Dr. Carey talked about a case. She presented a case, and part of that case was the athlete was experiencing confusion with their leg, like it was affecting them, and they didn't have it. They didn't have this kind of like sense of clarity about what's going on with my leg. They're disassociating, and it was an issue connected with REDS. And I'm wondering, in your experience, when athletes are experiencing some kind of injury or physical performance impairment connected with REDS, how do you go about educating them, to tease apart like the physical and the emotional, and maybe helping them understand why they might be confused here if it's connected with REDS?
Yeah, I mean, I think again, like from those pictures of the REDS, if we know that REDS, just like we know like clinical eating disorders can affect the emotional and the physiological or emotional and psychological aspect of an individual. And so as we gain more knowledge about those associations, kind of providing that to athletes, I think, it sounds like what I would say is like, using some of that like therapeutic techniques that we would use with someone who presents for therapy, because there's such an emotional, when you're talking about that, I'm thinking of like the emotional attachment that, a lot of my patients that I see with eating disorders have. It's not just all physical. There is a large mental and emotional component. And so I can see that being translated very easily into the work with athletes. And again, I think that's, normalizing this experience, and that like we know that this can happen to individuals, and just being an athlete, you're not protected from this necessarily. So kind of normalizing their experience of, unfortunately, this is a consequence that can occur, but we have some methods, of treating or trying to address it.
Yeah, thank you, Isabel. I'm just, you're also making me curious. So many of the injuries that folks experience are often unseen. I'm thinking specifically about, concussion, for example, or a neurological condition, or, we spoke earlier with the panel from Sidelined USA about mental health aspects of this. From your seat in nutrition, how do you go about beginning a conversation with somebody who might be experiencing something that people around them actually can't see? There's no sling, there's no obvious sign that anything's wrong. And I know that Roland talked about this and Kendra did, about having a conversation, but from a nutrition standpoint, how do you go about entering a conversation with somebody when what they're experiencing is hidden maybe from a lot of other people?
Yeah, I think a lot of that goes again to this point of trying to decrease and eliminate the stigmatization that we see with mental health and these unseen illnesses or injuries, because truly they can have as much of a impact and consequence as a broken bone or something like that. And so what I've seen more is trying to go about it explaining in a way as food and nutrition are medicine as well. And so just as you would take any pain killers or would engage in some sort of physical therapy, feeding your body, or engaging in mental therapy, these are also medications that your body and mind need, and they wouldn't be any different than if you had a physical visible illness. So I would think I would go about it in that way, again, trying to decrease that stigma of these can be just as impairing, if not more, again, because of that unseen nature of them.
And also wonder, just referring back to Alex's presentation on interprofessional teamwork and so on, where do you stand on teamwork with sports medicine professionals? What's the role of nutrition with an athletic trainer or sports psychologist or coach? Where are you on that?
Yeah, I agree. I think, it has to be a full team effort, because the moment that you have mixed messages, it can be very confusing for an athlete. And then it puts it on the athlete to decide, well, who do I listen to? And, that is a lot to put on an individual. And so we, again, those risk factors that I mentioned for eating disorders, when we have coaches in the moment telling athletes that they need to, change their diet or change these behaviors for sports performance that may actually go against what the, physician or the nutritionist would say, that puts a lot of conflict within the athlete. And, unfortunately, we would probably see more of I need to perform, so I might do what the coach says. And so I think just having the, early in the season, every season, just everyone in the room being educated, being on the same page, athletes and leaders, again, to present with a united front, so that, because really the goal for everyone is for the athlete and the team to succeed. So I think everyone with that goal in mind, again, presenting in the unified front and everyone being on the same page of what would be the best way to go about that, reaching that goal.
Yeah, thank you very much. And thanks to the folks in the chat who shared those resources.
Yeah, those are awesome resources. Thank you so much, Isabel. Actually, I'm learning a lot today too. This is great. If there are any more questions that show up in the chat, feel free to just respond to them in the chat.
Okay, perfect.
And then, so we're going to have a short break until the next 7 minutes until 3:40. And then we're going to hear from undergraduate research. And that will be Brielle's not here. Logan Gallup. I'm sorry, I don't know how to say your last name, Logan.
It's Gallagher. Gallagher.
Gallagher. Okay, I didn't know if there's like a G somewhere in there. I misspelled it a ton of times. Logan
It's fine.
Gallagher, Leah Sinise, and Eden Miller will be speaking then. So if you guys want to go get some water or lemonade, if you're JCL, then go for it. And we'll be back in a few minutes.
Thank you,
Thank you,
everybody.
Isabel. That was wonderful.
Thank you.
And folks, thanks so much for hanging out with